You're listening to Southeast Radio's Business Matters with Karl Fitzpatrick in association with Wexford Insurances. Challenge us at Wexford Insurances 0818 31 30 30.
I'm now joined by Edel Lee Morris from Kerlogue Nursing Home. Edel, you might start by telling me a bit about your own background, please.
Well, I'm a Cork woman who spent 10 years of her life working in the Cork University Hospital in clinical audit for cardiothoracic surgery and management. And that led me to Wexford, where I took up the post here in Kerlogue Nursing Home in 2004, working for our company directors, Philip and Paula Stafford.
And how did a nursing home come about in the first place 10 years ago?
Well, Philip and Paula saw a niche market for private nursing home care that wasn't available in the county. And they decided to build a 63-bed nursing home. It's built here on 3 acres of land, just on the outskirts of Wexford town. Beautiful landscape gardens. And they tried to build a home that was basically home from home for people, and not a hospital setting, shall we say. So it was more of a home environment for people coming in requiring long-term care. That we're VHI approved and BUPA approved, so it's also caters for convalescent residents who come in maybe just for 2 weeks, need to build themselves back up and head back out into the community. And there's also a facility there for respite beds as well.
I know over the last 10 or 12 years we've seen private nursing homes pop up all over the country. What has been the driver behind that?
Well, we have a huge ageing population in Ireland, and the need has arisen for long-term care for people, either due to their circumstances living alone, but it's medical care that's required, medical nursing care that's required for people. And as a result, I suppose, of the government's initiatives with Fair Deal and subvention historically, it has opened the doors for people to avail of care that's required.
Tell me about some of these subventions that have been in place through the HSE over the last number of years.
Well, historically, subvention was provided. It was a contribution basically given to people who needed nursing care within a nursing home. But it didn't allow for people who would be on low income or in relation to the Fair Deal, we'll say people coming in nowadays, if you have a pension, 80% of your pension goes towards paying your home and the government will pick up the balance, whereas historically subvention was only a small contribution to the overall stay and payment that a resident would have to provide. So subvention now is obsolete, and Fair Deal has taken over from that for people coming into homes.
Tell me about how the nursing home has developed over the past 10 years.
Well, I suppose initially, as I said, it was a 63-bed nursing home. It's built on 2 floors, and we cater for a large mix of people and their requirements. But I suppose Philip and Paula saw the need for the home to be extended 4 years ago and added on an additional 30 beds. There's a couple of high dependency units in that, and they put in overhead hoists into the rooms. So they've really upgraded the product that's available for people coming into homes. And the staffing has increased immensely as well. Like, we've 120 staff now on our books here in Kerlogue Nursing Home. We deal with an awful lot of local suppliers. So I suppose they're pumping a lot into the local community, and people don't realise what a large employer it is within the town and what it is providing for the local people here in Wexford.
And what would the skill mix of that 120 staff be?
Well, your skill mix is based on the level of dependencies of your residents and what they require. So you have to have a certain allocation of nurses and carers in relation to the needs of your residents. We'd have a fairly big team as well in the kitchens, providing nutrition for the residents. And you'd have your mix then of domestics and maintenance staff. Well, we have 22 nurses and we'd have 46 carers. And then the rest is made up of domestic staff, kitchen maintenance, that kind of thing. And you have your management as well then.
How has the industry itself changed over the last number of years?
Historically, nursing homes would have been perceived to be a very cold place. They were hospital-based, whereas what's being provided now are much more homely. They do provide a very close link with the communities. So for people coming in, it's not as daunting. You know, they have social interaction, which they'd never have. St. Bridget's still have close ties with us and that people can go out there once a week. We have residents that go to St. Mary's in Togoat on a Monday, and we ourselves then would take our residents out in the finer months. We'd go to Johnstown Castle or the Bird Sanctuary, and we'd go to Kerlogue Show. We take a bus to Kerlogue Show every year, and so they're able to get out more if they want to go into town shopping. That's facilitated for them as well. So they're not a place that people are afraid to come into anymore.
Tell me a bit about the people that would be staying with you in Kerlogue, age profile and what they'd be suffering from.
Well, I suppose the largest age profile we would have at the moment would be between 70 and 80-year-olds, but we under the new agreements, under the Hikmah, we can take 18-year-olds over, up to whatever age is required. So there would be disability services that would use us. That's where probably the 18-year-olds up would come. You'd have acquired brain injuries, you'd have mental, intellectual disabilities, and then you'd have dementia, and then just people who would need nursing care then as well on top of that.
What would the average stay be for somebody staying with yourselves?
Well, under the Fair Deal, they initially thought that people would only be living for 3 years in a nursing home, but it's actually longer. It can be anything up to 5 years and up. We would have residents here that are still with us since shortly after we opened, and that's down to the level of care that they would be receiving.
So, for instance, when the Fair Deal scheme was set up for stay, the government decided that, in their opinion, people would live for 3 years, but probably not an awful lot longer after. So they would have costed that scheme on that basis. Let's say for somebody that stays with you over the 3 years, what way does the Fair Deal scheme work for them?
Well, after the 3 years, the rate that they were paying would decrease and the government would pick up the balance, and that would stay until they either decide to go home or they pass away.
Well, on that basis, the Fair Deal scheme must be working out at an awful lot more expensive than what they anticipated it would be for a stay. Can you see the Fair Deal lasting?
Well, James O'Reilly has said that he's going to review the Fair Deal and review the costings for the Fair Deal for each individual nursing home. So even if he does change the Fair Deal, the fact of the matter is people are still going to need long-term nursing care. So he may renegotiate a better rate for people starting into nursing homes moving forward, but there will still have to be something in place to facilitate them because there's always been something needed.
What do you think is going to be the impact on private nursing homes over the coming years?
Well, firstly, I'd say they're going to have to review their Fair Deal in relation to the number of years that people are paying into the scheme. So, as I said, it's initially at the moment it's 3 years. That'll probably have to be extended to the minimum of 5. Also, the other thing to take into account is the difference between the public and the private sector in relation to payments. The costings for a public nursing home are considerably higher and in some cases double than a private nursing home. And that's probably down to, I don't know, maybe it's the unionised staffing requirements that they have that we wouldn't have. So they may start to close some of those facilities in the future. I mean, they have made an effort to start that already. So I do think there'll be less beds coming online for public. They'll be starting to decrease.
Who's responsible for negotiating the rates on behalf of the government today with the nursing homes, and how does it work?
Well, at the moment, it's the National Treatment Purchase Fund that come in on a yearly or 3-yearly basis, whatever you have negotiated for your rate for the year. And they come basically and look at your costings, which are transparent, and decide on the rate moving forward for the year. So it may be a case that you may get an increase, it may be a case that you stay at the same rate, or it may be a case that they would decrease your rate that they're currently giving you for your residents. But unfortunately, in relation to that negotiation, they don't take into account the dependency levels of the residents within a home. So you basically get the same rate for somebody who may be low dependency to someone who is maximum dependency. And we have to still provide a correct skill mix for that, but we're not paid for that skill mix.
Now, in relation to Hikmah, tell me who they are and what they do in relation to the industry itself.
Hikmah are our new regulating body in relation to the standards and the requirements for running a home. They have nothing to do with the financials in relation to the negotiations of a home. And basically have improved, I think personally, the standards within the private nursing home and public nursing home facilities within the country. We'll say, for example, we now have a residents committee within the home where the residents are very involved with the day-to-day running of our home. They meet on a fortnightly basis and discuss their menus, their activities, if we're doing any refurbishments, anything like that would need to be included. And it's all done with their interaction, which wouldn't have been a requirement before. The families are much more involved as well in the running of the home, which is lovely for us, and we get very good feedback from them in relation to that. And I suppose the Hikmah just basically keep an eye on everything to ensure that you are running a well-managed home.
The government have given the responsibility of regulation from a quality assurance perspective to Hikmah, and they've given the responsibility of negotiating the rates to the NTPF. So they've separated the two. One of the big criticisms of the NTPF out there across the board with nursing homes is the fact that, look, as you rightly said, low dependency versus high dependency, the nursing home is paid the same. Do you see that changing in the years ahead?
No, because I don't think they can afford to pay for that. I mean, I suppose from a nursing home point of view, you have to keep a very clear look on your costings and make sure that the nursing home is being run well. They're not going to change that in the future. If anything, they'll probably try and negotiate your rate down, but that will only decrease the quality of care provided to residents, which they can't do. And
how transparent are the costings of each individual private nursing home when it comes to negotiating with the NTPF?
Just to be clear, Karl, we have 80% of our residents under the Fair Deal scheme at the moment, and we're delighted to be able to provide that service for them. But when the NTPF do come to negotiate, they're only negotiating purely on bed, board and laundry. They do not provide any other services for residents within the home. That's either down to the provider to provide or to try and make up the difference with families. So we'll say in relation to someone needing to go to a hospital appointment, there was a time that the hospital would send an ambulance out or a taxi to collect someone. That's not the case anymore. Families have to either try and take their time off work or get someone to come in and take them, or they have to provide a taxi. And it could be a case that you have someone going as far as Vincent's in Dublin and would need some form of transport to take them there, and you have pensioners now trying to find the funding for that themselves. There's cutbacks in relation to the amount of occupational therapy being provided, but that's across the board. We have a very good service with the OT and that in Grogan's Road, but it's getting more and more difficult in relation to what is being provided for people, even down to their own nebulizers and all that. That's all the products have been cut that would have been covered under their medical card at one time. So the nursing homes are taking the hit for that as well in our own costings. That doesn't come out of their fair deal rate, we'll say.
I'm sure that you'll be familiar with the bad publicity that both public and private nursing homes have got across the media over the last number of years, especially since Hikmah have come in and carried out audits in relation to nursing homes. Talk me through the process that Hikmah go through when they do arrive at your door.
Well, firstly, we have never known, nor do we know, when Hikmah are coming to see us. The only time you get notification of a visit is when it's your registration, which happens every 3 years. Other than that, they can walk through your door at any time, day or night. So, and we welcome them coming in, I have to say. They have a set procedure, really, where they come in and they spend time talking to the nursing staff. They spend time talking to the residents themselves. They speak to families who are in visiting. And they build up a fairly good picture of the running of the home ever before they speak to you. So they know what the place is about. They go through the records for the residents, and basically it's all about patient care and transparency, and as to the running of your home and making sure that you are upgrading all the time, moving initiatives forward, and basically that everyone is happy. And you have infection control now, which would be a huge issue. And all those requirements have to be met. They do give you time if you don't meet certain requirements to improve measures. And there are costs in relation to those too, but where possible, you must try and meet them.
Apart from the NTPF driving rates down to nursing homes across the country, what do you perceive to be the other threats facing the industry in the years ahead?
Costings really is the main one for anyone running a nursing home in today's society, because your electricity, your oil, they're all going up all the time. there's less and less being provided for the residents. So I suppose the provider is having to pick up the costs for that, or the families, and the revenue isn't there for those. But I suppose the main thing really would be your staffing as your biggest cost, and that's not going to change because you can't reduce the level of staffing and care you provide to a resident. I mean, the average nationally for any nursing home costing staff is nearly up to 60% in their overall turnover in any given year, which is very, very high. And I suppose anyone managing to do it considerably less couldn't possibly be providing the skill mix required. And that's where Hikmah come in, really, to ensure that that is being done.
Do you see more nursing homes opening across the country in the years ahead?
Demographically, definitely there's a need in certain areas. I mean, Dublin have the population, Cork, Kilkenny, there's certain areas where definitely there is the need. Wexford, I feel at the moment, has enough beds in the county, and there's enough business for everyone. And I suppose we work very well together now in this day and age. We would meet and we would chat and discuss different ideas, and they may have new products that they may have seen coming online. And so we do work very closely together, and we have close links with the NHI, which is the Nursing Home of Ireland Association, and they would feed us a lot of information in relation to any changes coming on board through be it the government or anything like that. So I suppose moving forward, we're in a very positive place than what we would have been 10 years ago.
Edel, over the last 5 years, we've seen a huge number of home care providers set up across the country. Do you see those as a threat to nursing homes at all?
No, I don't. If anything, we probably work more closely with them in the last number of years. They refer people into us, and in return, we would, when a resident gets to a stage where they're ready for independent living, they would be referred back through a home care provider that would be able to look after them. But I suppose from our point of view, anyone coming into a nursing home under the Fair Deal scheme has to have a medical assessment done that deems them fit for long-term care. So as a result, that means they cannot stay at home and be looked after independently. So it's 24-hour care that they now need. So basically you have to qualify for that, and if you don't, well then you're going to stay at home with your public health nurse and your home package in place from somewhere else. I
suppose on that basis as well, no matter what somebody has an interest in staying at home, no matter how committed they are to living in their own community, the HSE certainly wouldn't be in a position to provide them through the home care package with 24/7 cover, because it just wouldn't be feasible.
No, it would probably work out as expensive rather than staying in a nursing home full time. If someone needs long-term care, they need their 24-hour care, and that's it.
Edel, how have the services provided by nursing homes across the country evolved over the last number of years?
Well, by today's standards, they're providing hairdressing, so people don't need to go out if needs be. There's chiropody. You have physiotherapists that come in-house. There's dietitians that come in and discuss people's diet and nutrition. There's OTs. So across the board, every need they try and cater for. Some homes provide massage, there's pet therapy, and as I said, they have very close links with the community, and plus the communities come in as well. You'd have maybe public libraries coming in doing storytelling throughout the year. You've positive ageing week, so they try to spend a week trying to find something that is relevant to the residents' needs, and that's it really. But I mean, they do provide an awful lot more than what they ever did.
And what has brought that about?
Well, it's probably down to most nursing homes, I think, would always have provided some level of services. But under the Hikmah regulations, I think nursing homes across the country have tried to improve the services that they provide to a resident, in that they try and cater for all of their needs. You have an optician that will come in, the dentist will now come in, and the opticians and the dentists are covered under their medical cards, which is a great service for them.
Finally, what's your outlook for the sector, the healthcare sector, the nursing home sector over the coming years?
Well, I'd like to think that it's a positive one, and that people won't be afraid to come in and move in and live their lives with us. I suppose the staffing and the training has increased and will continue to improve in relation to the needs of the residents and end of life and palliative care, and that it'll be a happy place for people to come in and enjoy.
Well, Edel, I'd like to take this opportunity to thank you for dropping by this morning and wish you continued success with Kerlogue Nursing Home.
You're listening to Southeast Radio's Business Matters with Karl Fitzpatrick in association with Wexford Insurances. Think Wexford Insurances for your business insurance.